Hi everyone, this is Dr. Mehmet Erdoğan by Smile Hair Clinic. Today, in the Hair or Dare episode, we are going to dive into Joe Hart's hair transformation. A legendary goalkeeper. Today, we are not talking about his saves. We are going to dive into his hair transplant journey. Joe Hart is a goalkeeper. He's played in Manchester City, in West Ham, Celtic, and also many clubs. But he's his 20s. He is more noticed about the audience about his hairline journey. So we are going to talk about his method, his hairline, his receding hairline, and also his transformation. Okay, so let's dive into his breakdown of hair transplant and hair loss problems. So it's 2021, he's almost 34 years old, and as you see, it's very different in each angle and each photograph type. We also see the similar things with the patients when they send photos to us. Sometimes it's very good in the right photo camera angle and the resolution, or sometimes it's very looking worse. So in this part we can see a very dense good hairline in the frontal part, but his temple parts were receding. But in the other one, probably it's because of wet, maybe because of sweating, he has little more receding like hair type in the frontal parts. Yes, the same thing for the temple part, but the frontal part's appearance is very, very miniaturized. Miniaturization is something that is the onset of the hair loss actually. Sometimes the hair just falls off. We see that with the full thickness of the hair is just falling down, or sometimes miniaturization means thinning of the hair follicles day by day, week by week, or month by month. And until a certain period, it's not very noticeable actually. Okay, so video is always different than photographs, and we see much better, but of course with the light, he's in a very light area. That's the reason his frontal part, especially the frontal central part, is very, we can see the scalp through. So that makes him to think about the transplantation. These parts, yes, but here I think he thinks that he needs a transplantation. But on the other hand, I mean, when we are deciding about the hairline, we are always having the proportions of the face. So in the other screenshots, I will show you some of them about the transplantation, but now I would like to also mention something very important. We take 1/3 and 1/3 and 1/3. So from chin to nose tip to glabella, and from glabella to hairline. Sometimes patients, we are always talking with the patients about decision of the hairline level, and in the hairline level, we want to follow these things if we have the enough graft number to cover everything. Otherwise, patients sometimes willing to too much lowering the hairline, but I don't think, or it's not very indication in the hair transplantation field that we want to follow that thing. That's the reason I think he doesn't have nothing to do with the hairline level, and what if we do the hair transplantation, we need to start from a lower point, but that lower point is, I think, out of the proportions. Okay, so in 2022, I think we have the similar thing, but I think in this angle we can see from his hairline level until the mid-scalp there is a miniaturization of the whole area, including the temple parts too. Right, in 2023, January and July, 6 months difference, but every time, of course, it looks different, as I'm always repeating the same thing. Also, sometimes patients or the people are using some hair loss products like Topic or something to give more density. That is another story of looking in different angles and different types. In this position of the patients, we are always wanting the patient from not totally losing their hair and they are just coming for the hair transplantation. We also want them to start some journey about the hair loss fight. It's some medications to be used, because in the early parts, if we use the right medications for right timing, I think we can improve the thickness nearly 30 or 40%, or even we should use in a lower density of extraction from the donor area. So these are important things about the transplantation journey, not only the surgical way, it's also the medical way too. Okay, I think this is a very good position that we can comment on, because he is looking just a little bit forward, so we can comment on his temple part. I mean, actually we are talking about his right temple part, and it is here dense, it looks very dense. Here is a little bit more receding, like the other side we can't see, but I think in the mid-scalp and in the crown area there is nothing that we can comment on. Okay, so in 2024, even it looks very similar to that, but I think it is maybe, as I told you, he's using some products maybe in those photos, but here I think it's more obvious that he has some receding just behind the line. In the Nordic scales, we sometimes see some central part of hairline is staying and remaining, and these are continuing. So probably he has a similar thing. I think in this part, we can also recommend him to have a surgery. Even in this condition, he could be a good candidate for a hair transplant surgery, but I think this is more suitable. And in the video that we also want to comment on is, in most of the patients, usually, I mean, after swimming, after they are out of shower or sometimes sweating, it's more obvious about the appearance actually. So he has the similar condition now, and still, I mean, this is a good position to comment on the hairline, possible hairline levels. We wanted to continue about his from central part to temporal part. If we do that, probably a V shape of the hairline is a little bit aggressive, but still suitable for his guy because he has a longitudinal face. Okay, so after retiring from the football, he is in the golf and he is using caps. I mean, as a golf player, they are usually wearing a cap or hat under the sun. It could be due to an advertisement agreement, or it could be due to he had a hair transplantation, but he's hiding, or he's just hiding it because he doesn't want to look like that. So we see in 2015, 2025, we see similar things like that. In the soccer rate in 2025, after the hair transplantation, we see his scalp as a shape. Probably he had few months back his hair transplantation journey. We can't see maybe from that. Yes, a prominent hairline. It's a very hair transplant hairline, but here we can see some redness as well. So probably it's very after the hair transplantation. Okay, I think he's talking about his hair loss problem and also his hair transplant journey. We can maybe, because of the resolution, we can't see it very well, but I can also detect some of the hairs that is in the line. I mean, it's very obvious, and I think it's not very natural hairline for now, but of course we should see when it grows. Okay, about his hair transplant, I mean, he's on the news that his fans, his audience is curious about he had the transplantation or not. So we can see the redness in that photos, because after the transplantation until the 3rd month or 4th month, when the hair is just totally gone due to shock loss, at that time we can see the redness. And also just before they are growing in their normal sequence, we also see some redness because of the circulation of that area. So there are so many hairs, thousands of hairs, and they need some circulation. So circulation create a redness on that area. So in the first months, maybe first 2-3 months of after the 3rd month, we can see some redness, but then the hair is covered and we don't see any redness anymore. Okay, so here, I mean, it's a very nice photo that we can select this hairline. In the beginning of the video, I just mentioned about that, so I wanted to continue about that. Here, I think it's very low, so they had no chance to change this hairline, because if we start in a higher point, it means that there are some hairs, the existing hairs below the line. So we need to remove them, or we need to repeat them. So if the patient has some natural hairs, we want to mimic the same direction, the same area, the same angle, so it's more natural. But here, I think there is little difference. It could be due to photo as well, but I think his left side is little lower than his right side. And also it is very straight for now, but it's too early to comment on, because we see the real result after 9 months, sometimes up to 12 months. So it's very early to comment on, but in the next time, I think we probably see a more prominent hairline. Okay, so we are in the 3rd month and we don't have the other month to follow, but we are following this patient and we want to see his journey to be completed. Probably you are curious about his progress too, but if you still have some concerns like him, I mean, he was the just right candidate. We don't know if he used medication or not, but in his condition, I think he first started to use the medication. If there is nothing improved, then he needs to go for the hair transplant journey. But after the transplant journey, I think he needs to use the medication too. So it's a like 360-degree and approach, a treatment approach. So if you are also in his stage, please try to consult by a doctor or by us to see if you have things to do or not if we continue just with the hair transplantation. Also, if you want to continue of the series of these episodes, we would like to hear from you who want you to comment on or who want we to review these kind of hair transplant journeys. So please write on the comments below about your questions, about who you are willing to see. We will be glad to answer and follow that. Thank you for watching us.